and know what to do should it not work. Okay? So make sure you know all these things. Akram is here, he'll help you go through this. But make sure you know how everything works. If you notice what I did earlier, it wouldn't blow. So I took the air water button out, the blue button, blue for blow. And then it started spraying water, then put it back in. And what that meant was a blockage in an airlock in the scope. So it's not a problem, know how it works. If you want to wear gloves, feel free. If you want lubricant on the scope, feel free. There is a special lubricant for the scope because it's going in a mannequin. Now, did we see also another valuable learning lesson? Too eager to get on with this.
Yeah.
So, as guys who want to learn how to scope, you're so keen to get your hands on this, you forget how to prepare your environment. So you need to make sure things are correct and right and happy for you before you move. Okay. There's a lot to do before you get your hands on this.
Yeah.
Now, I'm not interested in you getting round to the C-cam on this model. I'm just interested in seeing how you go for 5-10 minutes and looking at how your hands and how you hold the scope.
I just need to apply.
You wish. I hope you put more when it goes in a patient.
Yeah.
So, what are you doing?
Just started to.
You need to talk to me.
Yeah. Just started procedure and.
Okay, because I'm stood here, you want to turn, and you don't want to have your back to me. You're not being rude. Make yourself comfortable. I need to see how you stand. So how you stand is that leg forward, that leg back, that's great. I will do that to you, so don't worry. So you're not going to get away with it. Okay, so you're happy? Why are you using the little wheel? No, I'm just asking you, why are you using the little wheel?
Oh, just thinking.
So, where's the lumen? Stop. Where's the lumen? Stop.
Lumen is.
Stop. I can still see it moving. I'm looking over your ear. So where's the lumen?
Set around 3 o'clock. 5.
So, what are you going to do to proceed?
We just go a little forward and then.
How about just neutralising your hand here? Bring the scope up. Now where's the lumen?
Okay, 5 o'clock.
So just relax your hand. Relax your hand. And down. Keep going. Nice and steady. So what does pushing the big wheel do when you're pushing it forward? What does that do to the tip?
Just.
Stop. What does it do to the tip?
Will angle it.
Yeah. Which way?
I need to go down.
Okay. You're above the fold, so here's the fold.
Yeah.
You put the tip forward, and that's what it's doing to the fold.
Yeah.
You need to go beyond the fold, and then allow it to come down. At the moment, you've not gone beyond the fold before you can do that. So go beyond, see there? There's the fold. Where's the lumen?
It's exactly 5 o'clock.
You're allowing your hand to drift forward. Stop. Where's the lumen?
2 o'clock. Now 2 o'clock. I can go for
10 o'clock.
Where's the lumen?
7 o'clock.
What are we doing at the moment? So over there, you sound like an American. Over there, over there. All the ants are coming. Where's the lumen?
Around like
No, 6 o'clock.
6 o'clock. 6.
What's it caught on? Why is it not going forward?
It's over there. Sorry. It's head.
Don't argue with him. You focus.
10 o'clock.
You and I are talking. Let him just chirp away.
10 o'clock. 10 o'clock, I guess.
Stop. What did you say?
9 o'clock.
No, I guess.
I guess so.
Is it wrong or not correct?
Not correct.
Good. Stop. What else could you do to optimise how you approach it? Just draw back 2 centimetres. Yeah, that's good. See how it's gone forward. Good.
Then I can proceed.
So, if you stop there for a moment, one thing that I have, what are you here for? What's the purpose of this workshop? What's the purpose? Don't look away now. By the way, I've got eyes in the back of my head on my father. So, I know he's on the phone. That's why I'm disturbing him. I'm terrible. Do be aware I am terrible. So what's the purpose of this training course?
Learn the basic and
No, I've actually used the word. Okay, so what's the purpose of this workshop? To improve the skills.
So stop there, we particularly that we are not going right.
Which side with the colonoscopy?
Okay,
The
so,
alternatives without the same maneuver.
right, in the UK these courses are called training courses. What do you think? Do you think it's about training you?
training perception.
It is the basic skill sets or maneuvers to go through
So do you
the
think training's fair?
training through the hospital, but these courses are meant to develop the skills and maneuvers to get
So
along with the
what's
problem.
another word for that then? Stop.
Skills, I would say.
If I was to say to you coaching,
What?
coaching. So
Yeah.
what's the definition of coaching?
Coaching means to train in a special
Do you
method.
use training? It's not training.
It is a method of doing something. The training will come once we go through a
That
center.
particular activity, he knows about that thing related in a manner, but that needs to be improved. So,
Right. So
coaching,
that's what coaching means. Coaching means that you've already got a modicum of understanding, a little bit of understanding already, and you're able to do. You guys who are observers, you've come, and as yet you've not put hands on scopes for colonoscopes, you've not done many at all. So that's why understanding and coaching, you'd be more into the training than the coaching. So what you've got to do is actually go away and get a comprehension of what he's doing. At the moment, he's been able to get to where he's got to because he has got an understanding of how the scope comes. The purpose of us as faculty is to actually coach that and to make sure, and as a coach, how do you make a good team? How do you make an individual better? You get them to focus on a particular lot of skill sets.
Skill set, yeah.
Right.
Which
So-
are the flaws and correct it if there's any flaws or incorrect.
Just like once said here, the problem once going through
critical
the
opinion, like
curve, you should go after the fold and then go up, then you will able to see. If it is comes first, then it's not able to.
And so if I now say to you, how do the best get better? How did he get better? Practice? That's what.
Because he has a instinct of learning every time, even he
How
comes.
do the best get better?
Sir, like if you are doing under supervision,
by regular
like if you are
self-assessment,
getting
Regular self-assessment and assessment by whom?
assessment by
Supervisor.
a person who is more,
Self-assessment.
who has got more understanding or who has got more expertise.
Okay. Well, if I was to turn around and say to you, right, from this course is important to me, and it's important to Dr. Saab and important to Vakda. Why do you think it's important to us?
Because you are trainers, you come up from different problems for different people.
Now I'm going to say to you, how do the best get better?
That's the best mode of
Because everybody
learning,
at some
teaching
point
from this.
Because either ego of
So
the-
he gets better because he comes here, we revisit these skills, we look at how you interpret those skills, you feed back to us, and then we're able then to actually work on our own skills ourselves. So, the idea of these course and these little bits, I do stop you, these little bits, this course isn't just about you developing, this course is about developing. And when we come along, he looks at me and I scope and he'll say, you did this, why did you do this? I'll look at him and I'll say, you did that, why did you do that? And I'm not questioning, it's just I need to understand because you learn things. And this is where you, as trainer, and the reason why I've stopped you now is this. What you've got to do is be open to people asking you a question, even when you become a professor, even when you become a consultant. Because if you're not open to that, then you'll stop. You'll stop. Okay, my friend, let's have a little look. Where am I? So we're up here at this point. I'm happy with that. I don't think we need to go any further. There's no point in just progressing around. But we will revisit things where we were going to talk about body position and how the patient could come onto the back and various things. The thing in Pakistan is that I do avoid moving patients if possible, especially ladies, because putting someone on the back could be misconstrued, all these type of things. You've got to be thinking about who you are dealing with. So in coming here, I looked at what I did and how I actually do things. So it opens you up to a different way of doing it. So make sure that you are aware of who you are dealing with, what you are dealing with, and if you have to move someone, then you have to move them, but also optimize and make sure that the confidentiality and that the most discreet as possible. You will also see that I will hold the scope further away in Pakistan. So here, normally I would hold the scope here. In Pakistan, often I will hold it here, especially with ladies. Gents, not a problem. Ladies, it's here. Make sure the hand is always visible. Very, very important. You've got to do that. I won't go anywhere near anyone. A lady in particular, she'll tell you if I'm in the room and there's another gent in the room and the door looks like it's going to be closed, I will always open the door and stand in the doorway. Or make sure the patient is covered. But you have to respect who you are dealing with. Just because you're a doctor doesn't give you the right to throw that respect out. Think of who it is. Do you want to take it out and hand over to somebody else?
These are very small points, but this is what will take you to a different level. Every patient, you put yourself as a patient. If you come across somebody who cares for you, a doctor who's caring for things, I mean, imagine if somebody just opens up, takes the covering off. They are majburi, they're obviously, they have to have it done, they're not going to say anything, but they will not have the same feeling as they would if you respect their privacy, respect their like you said, the cultural things, and also those things are very important. I make sure, it's very important, you want to do a colonoscopy on a lady, you must have a lady with you. If you have no nurse, you have nobody, bring one of the relatives, make them stand. But you can't do a colonoscopy on a lady without having female staff around you, period. No discussion. Don't do it. I'm sorry, I can't do it on ladies. I don't have a lady. Okay, but you'll find somebody. But there has to be a chaperone, always. If you're doing anything under sedation on a lady or without sedation, you should not do any examination without another lady's presence. One day you'll be caught. And then it will be her words against yours, and it will be her words that always is given more.